Good morning, everyone. My name is CC Talley. I am the CBPCC contact at KDHE, and welcome to our first TA session of this upcoming cycle. And on the call with me are Amy Swanson, Desiree Brown, Carrie Parker, Robert Stiles, and I don't think I see an and those are will be some of your main CBPCC contacts for this upcoming cycle. And please note of the other TA session happening in January, shortly after the application will go live. Bye. Next slide, please. Okay, so a brief overview of the purpose of funding. So the grant funds for CBPCC are intended to make primary medical and dental care, prescription drugs, and preventative health care services accessible and affordable to underserved Kansas residents, including uninsured individuals and those enrolled in public insurance programs that are operated by the state of Kansas and/or federal government with eligibility based on income. And if you've applied for this grant before, you'll be familiar with the purpose of funding. If this is your first time to apply, or if there's been a gap since your previous allocation, it is important to note that CBPCC funding is allocated by the Kansas legislature, and therefore they are the ones to decide how much money this grant will receive each year. Next slide, please. These are your important dates for this upcoming application. Please, if you are a new applicant, please make note that you will have two very close deadlines in February. And basically, for the intent to apply, you must email us at the State Office of Primary Care and Rural Health with your intent to apply. And then we will send you the new applicant packet. You will then return that to us by February 16th. As always, the application will open on KGIMS on January 1st. And I missed a date there. I apologize. Should be 2026. Thought I caught them all. And then it will close on April 1st. And everything is due on April 1st, regardless if you're a new applicant or not. If you're a new applicant, you still have to turn in all your stuff on KGIMS on April 1st. And that includes the grant signature page and the online application. If you are a returning applicantee, your data is due via the data hub. If you are new, it is due via email submission to KDHE. Thank you. And please make note of these. And if you have trouble with KGIMS, just reach out to our office, and then we will then give you the contact information for the tech people for KGIMS who can help get you set up. And new applicants, please note that your budget is maxed at $50,000 for your first year. And this is going to be this is just a little disclaimer for everyone. So last year was my first year in this position. So this is my second year. And I've got my feet under me now, which means that starting with this current application cycle that we are in, so the SFY 2026, and if you turn in reports late, you will not receive your funding until your report comes in. And that will be the way it is going forward. So you will not automatically receive your money after deadlines, if that makes sense. And just a brief overview for the new applicants for your intent to apply. Please make note of this information that we will need from you. So when you email us, and our email will be at the end of the presentation, you must include the following information. We need the physical address of your clinics that will be receiving the funding, a short description of the geographic area it serves, max 3 sentences if possible, contact information for your administrator or director. We need primary and secondary points of contact, and these will be the people that I will be in contact with most. So it's usually your grant manager and fiscal people that these will be. We need your proof of not-for-profit or publicly funded status. We need a copy of the clinic's policy of non-description in the provision of healthcare services, and that includes but is not limited to race, ethnicity, religion, or national origin, and a copy of your sliding fee policy and procedure. Again, once you email all this information to us, we will then give you the new applicant packet. All right, next slide, please. Okay, that also didn't change. I apologize. Not sure why it didn't change, but the application will be sent out later. KGIMS has been a bit buggy, so I haven't been able to download the application properly. Once it is, I will email it out to the provided list, and then the instructions are hopefully in the chat. Next slide, please. Okay, so just a reminder that the CBPC funding is a competitive process and funding is not guaranteed. It is also not guaranteed that you will receive the amount you requested because we use a specific formula. It used to be in years past that returning grantees could count on receiving similar funding year after year. However, because there are a continuous amount of new applicants each year, this affects the funding amounts. Now, so far, I believe everyone who has applied in the last year or so has gotten funded. So please apply and make use of the of the money. So just to break down how your application will be scored. So your applications will be reviewed and scored utilizing a matrix that is scaled 0 to 4. The entirety of the application is worth 100 points, and a failing score is 59 or lower. In years past, we have done this by having a review committee of both participants from our office and CC&K. It has not been decided yet how that will be going forward, but it is usually a committee of people reviewing, and then we average out those scores. Now, just a heads up, we don't encourage using copy and pasting for this application because of the nature of it. The text can become distorted in KGIMS, and therefore it can be unintelligible for us to read, and that can affect your score. And also, some of the questions change year after year, And so you just need to make sure you read them carefully to make sure you are following the guidelines. This year, we are not planning on imposing a character limit. Similar to last year, we just encourage that you are thorough, but not long-winded in your answers. We love to hear about everything y'all do, and we love to hear about everything that the money goes towards, but we don't need pages and pages of introduction information, if that makes sense. And then, as a heads up, as we go through the presentation today, you will see an asterisk on some of the questions. And that means when you go into the application on KGIMS, you'll be able to hover above the question mark icon, and it will give hints, tips that you can refer to. And that should still be applicable this application cycle. KGIMS has been updated, and there's been a lot of changes going on there. But that should still be applicable. Next slide, please. Okay, so there are 6 main criteria for eligibility. First and foremost, the clinic has to be a not-for-profit or publicly funded primary care clinic that offers comprehensive primary care services and/or dental services. You do not have to offer both. You can offer one or the other. 2, the clinic serves any person regardless of ability to pay. And 3, the clinic offers a sliding fee discount based upon household income and family size. And important to note, the sliding fees policy must be documented and available upon request and has publicly posted signage. You will be asked to submit this signage to us, and it's usually a screenshot of your website where it is posted, a picture, an up-close picture of where it is in your lobby, and then a far-away picture to show in relation to where everything is in your waiting room / lobby. And if you have questions about the sliding fee scale policies, please consult the HRSA website, and you can just look up sliding fee discount program and or the Community Health Center website. Next slide, please. And for the next 3 criteria, you must have 10% of the clinic's total unduplicated patients at or below 200% federal poverty guidelines to receive a sliding fee scale discount. And if you have questions about what the 200% FPL is, you can look it up. I believe HRSA also has that one posted. And the total unduplicated patients of eligible clinics must at a minimum mirror the disparities present in the county being served. So that wording's a little complicated, I know, so I'll try and break it down for you. So if your clinic is located within a county with a reported 30% of its residents living at or below 200% FPL, your clinic's patient reports must mirror that. So if your clinic has 30% FPL, if your county has 30% FPL, the amount of patients should be 30% FPL, if that makes sense. Examples or estimates are not allowable within the application. We understand that sometimes patients elect not to report their financial situation. So we do have policies surrounding justification narratives for that missing data. Um, we understand that people like to have their privacy. And finally, submission of accurate and complete quality improvement QI data for the previous calendar year. So for this application cycle that is opening in January, that quality improvement data would be from this calendar year. And grantees must also sign a data release with CC&K so that we can access and use the QI data in the funding formula. And additionally, to note, there will be some edits to the application this year where we will directly ask about this data as well. So there is a chance that you will have to not only write it in the application, but also report it to CC&K, if that makes sense. All right, next slide, please. And from here on out, I will start breaking down the application itself. So the first question is basically a guaranteed point. You just have to indicate which application training you attended. If you attended both, fantastic. If you did not attend any, which doesn't pertain to any of y'all here because you're here, you would not be eligible. Next slide, please. And then starting into section 1, we just ask you to select if you are a new applicant or a returning applicant. And this can get a little tricky if you used to receive CBPCC funding but haven't in the last year or so. If you are in that situation, you would still select that you are a new applicant. And then we ask you to please select which service or both your clinic is requesting funding to support. And that's either dental or primary care. Next section, please. And then this is the question that the answers can get quite long-winded. So this is one of the areas to be thorough, but also concise. And that is basically your opportunity to tell us all about your clinic and make sure you answer every aspect of this prompt, especially the locations. That helps us figure out where in Kansas everyone is located. And most importantly, I shouldn't say most importantly, but the aspect we see missing the most in this introduction is the mission. So make sure you clearly outline the mission. If that means you have to put it in bold and with quotation marks around it, that's fine with me. We just want to make sure it is very cut and dry what the mission is. And we don't, because otherwise you'll be docked a little bit for that. Next slide, please. These are more easy to win points. We just ask you to provide the name and email of your CEO and the name and email of your CBPC grant administrator. So the person who will be in KGIMS, usually submitting the progress reports. And if that's the same person, that's perfectly fine. I believe there will also be an option for another point of contact, and this is usually people's fiscal administrator, the person that will handle the financial reports. Next slide, please. Thank you. And the next area will be asking about your data. And so you'll just have to indicate what kind of population density y'all are located in. And it has been, I believe the requirements have changed very recently, but I'm not sure if that is concrete, hence why I haven't changed it here. But you can double check. I'm guessing HRSA has it, and probably a few other um, agency areas have defined what the population density requirements are. And so just indicate that. And if you have multiple clinics that will be receiving, like if you have, trying to think of how to word this, we'll say multiple clinics that will be receiving the funding. I would say, and they're not all in the same county, just, total them up and average out the counties to see if you are a average of frontier or rural. Next section, please. So these will be some of the data questions. And please note that whether we ask for how many or percents on these questions, because these are some of the numbers that we'll use to help calculate your funding. So for question 4, about how many clinic visits were provided to patients at or below 200% FPL during the 2025 calendar year, make sure it is a whole number, please. And then for 5, what was the total value of services provided at or reduced cost in the calendar? I believe it would be I'll come back to the unduplicated patients question. I'm gonna think about that while we go. The total amount of services. This will also, if you can make this a round number, if possible, and if you are a free clinic, just make it apparent somewhere in your application that you're a free clinic. That way, we know and aren't tripped up in case you just write 0 for question 5. Okay, next slide, please. And then question 6, what was the total value of charitable care write-off in the calendar year 2025? And this will include financial assistance other than the sliding fee scale. And we don't ask for documentation of these financial assistance. We just require a sliding fee scale. And then we ask you to describe what criteria your clinic uses to determine charitable care eligibility. And if it's separate from the sliding fee scale, and you happen to have documentation for it, please upload it. But we also understand if you only use the sliding fee scale or other means. And then next section, please. And then this is basically how do your patients know about your sliding fee scale discount policy? And for most people, they'll just say it's posted in the waiting room and it's online. And then you also will be sending us documentation of that. And if you happen to do any other outreach discussing it, just detail it here. Question 9 is pretty easy. Do you have policies in place to address bad debt? We'll just select yes or no. And then if you select yes, we just ask you for the total dollar value of bad debt write-off for this year. And then we ask you to upload the policy. And then next slide, please. And then this section, we ask you to be very precise in which boxes you check. And If you happen to check a couple, it couldn't hurt to include how y'all use those in your introduction. That way um, I don't want to say have proof, but have something to go off of for this section as well. Okay, next section, please. And then this will be another set of boxes, and you'll just check all of the services your clinic offers. And if you do select other, please just be pretty detailed about which other service you provide. Next section, please. And then this will be another set of checked boxes. And like earlier, if you can, it couldn't hurt to mention these in your introduction. That way we have something to go off of. And if you have questions about any of these sections, don't be afraid to reach out to us and we can help break it down about whether or not your clinic qualifies for some of these, because it can be a little confusing. And then next slide, please. And then these will be another round of checked boxes. And it's just asking, to which of the following services does your clinic make referrals? And once again, if you check other, just detail what it is so that we know. Next slide, please. And these are some very important questions upcoming. And question 14 basically gives you a chance to describe anything that happened. So the previous fiscal year would be this year. That occurred during this year that affected activities, accurate information, data, that sort of thing. And you can be as detailed as you want with these, because we want to know if anything major happened at the clinic. And this can, if you have multiple clinics and one shut down, that would be one of these. If you were short-staffed, that would be another thing. So anything you can think of to write here and that you want us to know, we appreciate. Next slide, please. And now we are on to the second section, which is the primary care section. And after this will be dental. And so they'll look pretty similar in terms of questions. And so for the first question, we will ask you to describe your clinic's activities and efforts related to care coordination and or patient-centered medical home over the last calendar year. And we have definitions here for those two. And if you have any questions about it, don't be afraid to reach out and we can break it down again. Next slide, please. So for the second question, we ask you to identify your clinic's medical services and patient reach trends over the past 3 years. And please note that the past years will be 2025, 2024, and 2023. And that is very important. And if you are a new clinic, please fill this out the best you can. And if you haven't been tracking it, please make note and we'll keep that in mind. And then for question 3, we will ask you to describe what vulnerable and underserved population that your clinic serves and the outreach activities y'all do to engage these populations and promote your use of your clinic's services and what tools y'all use. Please be as detailed as you can for these, and also very clear. The clearer you are in your answers in general, the easier it will be for us to score your application. And then next slide, please. And then continuing on, we have describe your patient education and health promotion activities that focus on vulnerable and underserved populations. So this is like a continuation of the previous question, but this is usually what I've noticed is that a lot of people will talk about school activities and like YMCA-esque environments where they reach out. And if you have any questions, you can once again reach out. And then question 5 is the big one is we'll ask you to provide at least one SMART goal for this upcoming grant year. And we have an example that Mel created last year of a SMART goal if we want. Perfect. So the important things to note is SMART is an acronym. So just make sure you hit all aspects of the acronym. So for Mel's example, by November 30th, 2026, reduce new patient appointment wait times by 25% from an average of 4 weeks to 3 weeks through process improvements, including optimizing scheduling systems, enhancing staff allocation, and providing trainings for administrative staff as measured by appointment wait time data over the next 6 months. And then she breaks it down here, and don't be afraid to break it down to each letter of SMART if that will help. And we don't mind y'all doing that either. So for the specific aspect, it's reducing the patient appointment wait times by streamlining scheduling processes and improving resource allocation and utilization. For measurable, it's to achieve a 25% reduction in the patient appointment wait times, and this will be measured by average wait time data collected from appointment records. Next is achievability, and this will be through implement strategies such as optimizing appointment scheduling software, adding extra clinical and support staff during peak hours, and training administration personnel to handle scheduling more effectively. Next is relevance. Improving wait times aligns with the goal of enhancing patient satisfaction and increasing operational efficiency in the health center. And lastly is time-bound. Achieve a reduction in wait times within the next 6 months. So the November 30th, 2026. And like I said before, we do not mind if you have to break it down to each letter of SMART, especially if that will help you create a well-rounded SMART goal. And this is the section that we see the most likely area where points will be docked because clinics don't make a well-rounded SMART goal. So please make sure you spend quite a bit of time creating your SMART goal to ensure that you can get your points there. Next slide, please. And then these next two will be based upon your SMART goal. So for 6, we ask you to describe the activities you have planned that will accomplish your objectives listed in your SMART goal. And then for 7, we ask you how you will measure progress and results and outcomes of the activities that you planned in question 6 that will achieve your SMART goal. And it is likely that you will answer these questions in your SMART goal. We just ask that you reiterate it in 6 and 7. And then we ask you to describe an NDH measures related quality improvement activity your clinic implemented in the past calendar year. And so, as you can see by the asterisk, this will be one of the 14 required measures, and you'll be able to see those in section 5 for a list. Next slide, please. We are now on to dental. And once again, we will ask your clinics to, and before I dive in, if you are not applying for dental, you can just write, we ask you to write an A for all of the questions. And if you're applying for dental but not primary, just write NA for all the primary care, please. Don't leave them blank. But yeah, so for the first slide, for question 1 of dental. Oh, next slide, please. Thank you. We ask you to describe your clinic's efforts and activities to integrate primary care and dental health services. And then, just like in primary, we ask you to report your dental services and patient reach trends over the past 3 years, and the factors which affect your clinic's trend in the number of visits completed and patients seen. And as I said earlier, this will be 2023, 2024, and 2025. Next slide, please. And then for question 3, we ask you to, like primary care, describe the vulnerable and underserved population that your clinic serves and your outreach activities to engage these populations and promote the use of your clinic services and what tools your clinic uses to assess community need. And then for question 4, we ask you to describe your patient education and dental/oral health promotion activities. Thank you. We then will ask you for a SMART goal. It would be a similar example to the one given in the primary care section, but no, it would actually work for the same goal would work because it's patient waiting times. And just make sure you hit all aspects of the SMART acronym. For question 6, we will then ask you what activities you are planning to use to accomplish the objectives listed in your SMART goal. Next slide, please. Just like in primary care, we will ask how your clinic will measure the progress, results, and outcomes of the activities you listed in question 6. And then we will ask you to describe an NDH measure related to a quality improvement activity that you have implemented in the past calendar year. And then we will ask you to describe with measurable data what NDH quality improvement measures were improved in the past calendar year. Next slide, please. We will then ask you to describe an NDH measures related QI, quality improvement activity, planned by your clinic for the next calendar years. So that would be for this application cycle, that could be 2026. And then for question 11, we're asking you to describe any participation in quality improvement activities. Please include working groups, accountable chair organizations, statewide or national initiatives such as Kansas Healthcare Collaboration, Hospital Improvement Innovation Network, and Kansas Clinical Improvement Collaboration, or Kansas Mission of Mercy. And then for question 12, please describe how these grant funds will improve dental patient outcomes and affect your clinic and patient population. Next slide, please. Thank you. We are then on to appointment data, and this will be for both groups. We'll ask you what is the average wait time in calendar days for a new medical patient to be seen for a routine, non-urgent appointment. And please make sure this is a round number, please. And then we will ask for the average wait time for a returning medical patient to be seen for a routine appointment. And then the average wait time for a new dental patient to be seen for a routine appointment. And then there will be a section for average wait time for a returning patient, a dental patient to be seen for a routine appointment. And as I said earlier, make sure these are all round numbers. And we appreciate that very much. Next section, please. These are your NDH measures. And so you'll use, you can reference this section of the application to answer the earlier questions. And we just ask you to select which measures you are gathering and which you intend to gather for the next year. And obviously, if you're only applying to primary, you'll just need to do clinical measures. If you're only doing dental, you'll just do the dental measures. And if you're applying for both primary care and dental, we ask you to check boxes in both areas, please. And thank you. Next slide, please. And these are your supplemental documents. These are very important and they are absolutely required. To note, you will upload these on KGIMS. If you have trouble getting them on KGIMS, don't be shy to reach out to me, and you can, or if you're missing any and can't upload anymore, you can reach out to me and email any missing documentation to me within the open application period. After the application period is closed, we don't accept any more uploads. And you'll just check off the boxes as you go on KGIMS for which documents you have uploaded. And the documents you will need are certification of in-kind donations, if applicable. We will need community engagement examples, and this can be multiple. It doesn't have to be just one document. You can upload several documents to this section. We will need your sliding fee scale policy and procedure, and we'll also need the pictures of the policy posted within your clinic. We will need proof of your not-for-profit or publicly funded status, your operating budget, your local match worksheet, your clinic site table, your charitable care policy, and if not applicable, just upload a document with an explanation, and we'll need your bad debt policy. And please note for your local match worksheet, CBPCC still runs on a 1-to-1 match minimum. So whatever you receive from the state of Kansas, you must match it with your own funds. And then you can, of course, match with more money than what is given, and that is perfectly fine. But the 1-to-1 is required. And there is and if you have trouble with the budget, you can reach out and I will gladly get you in contact with our fiscal, KGIMS fiscal person for CBPCC. All right, next slide, please. And thank you all so much. And I have time to take y'all's questions if you want to ask any.
Cece, did you want to circle back around to the section 1 question for question 4? Is it unduplicated or duplicated patients for calendar year 25?
Yes, I believe we would like it to be unduplicated patients, please, because that is what we will base your funding off of. And I will make note to make sure that is very clear in the application that is unduplicated. Any other questions?
Hey, good morning.
Uh,
This is Dennis Clare with Hunter Health. Forgive the question. You may have clarified this earlier. You mentioned this is a funding allocation decided by the legislature. And
mhm.
has that amount already been decided, or will that happen this upcoming session?
Um, I don't believe it's been decided yet. Amy?
That's correct, Cece. It will be decided this upcoming session. Mhm.
Okay. Just showing my new guy naivete,
Mm.
is there typically a threshold within which the amount, like, does it swing wildly every year? Is it typically within like a certain amount?
It hasn't swung wildly, I wouldn't say. We had, as a result of CCNK's prompting, there
Advocacy.
have been increases in recent years of about 3 million, I think, for the last couple of years, which remains steady. It was 3 million addition, I think, 2 years ago, and then that remains steady. And Robert, you can correct me if I'm wrong on those numbers. As long as I've been here for the past 6.5 years, we have only seen maintenance or increases,
Okay. Wonderful.
no decreases to date.
Thank you.
There's a question in the chat. Can they ask for additional funding for calendar year or the state fiscal year 27, or do they need to stay at their current funding level?
Yeah, so if you are a returning applicant, uh, you can ask for, I don't want to say any amount, but yeah, you can ask for an increase for sure. You just have to make sure that it is reasonably spent within your budget. It will be shown, your budget will detail how everything is being spent. But yeah, you can definitely ask for an increase, but the increase isn't guaranteed. Um, is basically just showing how much you would like to receive. Um, and then once the actual award amounts have been determined, you will then remake your budget based on that, if that makes sense. Any other questions?
So there was a question about once the applications are reviewed and scored, what was the internal process to determine grant amounts? Amy answered that it's a funding formula that is determined to that determines the grant amounts, and he's wondering where can they find that funding formula?
So we've done a couple of presentations, at least in the last year, around the funding formula. And it is not a spreadsheet that we can just hand you and say, if you do this, then this will happen. There are numerous variables that go into that funding formula. Though we have provided the overarching, there are basically three buckets. And the application scoring is included in one of those buckets. The number of patients at or below 200%, the federal poverty level that you serve is in one of those buckets, and the number of people you serve that are uninsured is the third bucket. And so we have shared those percentages, those buckets, and provided information about how we establish the adjustment factor that we use. So we are able to, depending on the amount that we're allocated each year by the legislature, plug that into the formula. And then based on all of the data that you report in your application and within KGIMS and to CCNK, those factors that are then all taken into account for all clinics. So if another clinic is serving a much higher number of clients this year than they did last year, that gets taken into account too. So there are all these variables that can raise or increase the funding amount. And thank you for sharing that. Oh, that's your evaluation.
I can say safely though, the because the data is not something that you can just change all of a sudden. I would say focus on making sure your application is well-rounded and that you've answered every question in full. That is very important because the application, because it is 100 points, and I believe it's one of the 40% buckets, is weighed quite heavily for the funding formula. So make sure that you have a good SMART goal. You've described everything in detail. You've checked all the boxes. Yeah.
And we can share a PowerPoint from one of the previous presentations. CCNK may also have one of those recorded. Carrie, I'm not sure. It's been a while since Kat did a presentation to the CEOs, maybe a year or so ago, maybe a couple of years ago. That one might be recorded.
We'll take
It
a
would
look.
seem as if that would be a pretty vital thing for all of the potential grantees to know about.
Yes, we've shared that information and been open with.
Again, the whole idea is not that you have shared it, but that, we can find it. I am not aware of when it has been presented. I'm relatively new. And so again, I'm just trying to find out where I can get that information. Not that you
Yeah.
have presented it, but where can I find it?
We can share that PowerPoint with you.
Thank you.
And if
You're
anyone
welcome.
has questions about it, you can reach out to our office, and I'd be more than happy to host an impromptu session for your clinic about the application and the rough breakdown of the formula, if that helps.
That may well. Thank you.
And thank you, Brenda. She did put those percentages, those buckets I was referencing into the chat.
Oh. Are there any other questions? Perfect. Well, if you guys have any questions or need any help at all, don't be afraid to reach out to us. I will say, my email is definitely the way to go. I can get back to you pretty fast for those. And I can also loop you in to, if you need help with KGIMS, I can loop you into the KGIMS team or the fiscal team to help you with anything you might need. So if there's no other questions, thank you all for coming. And I hope you have a good application cycle.
All right. Thank you, Cece.